Hi everyone, Dr. Steph here from Living Health Integrative Medicine, and I wanted to talk to you guys today about fluoride. Most of you have probably grown up with the idea that fluoride is something that we need to prevent tooth decay. It's certainly been marketed that way to us, but I want to give you some information that's just quite shocking actually, about the medical hazards and the health issues and the negatives to fluoride, and why really it should never have been put in our water system and in our toothpaste and our products at all. And what I'm going to do is I'm going to reference specifically some comments made by a medical doctor, Dr. Paul Connett, who put together this article on fluoridealert.org. So the link is below my video today. I do implore you to do your own due diligence. I'm going to just bullet point through these because I really want you to see the negative impacts just, you know, in a very quick way. But it's basically a 60-page article. If you were to go on to fluoridealert.org, and you can read it. The reason why I'm going over this today is because a lot of the patients that we see are dealing with chronic issues, chronic ailments, autoimmune diseases, thyroid disease, obesity, cognitive impairment, all these different things, and a lot of them are potentially related to fluoride accumulation in the body. So fluoride itself is a halide molecule that's in the same sort of category as iodine and bromine and chlorine. The thing is that out of all of those, iodine is the only one that our body has evolved to absolutely need for survival and optimal function. Fluoride is toxic and deadly. It is the base compound in most herbicides, pesticides, and antibiotics. An antibiotic is, of course, alludes to the fact that it's anti-life. So on occasion, we take these things because we are concerned about a bacterial infection that could, take you out. So periodic use might be one thing, but we have it in our water system. Almost 180 million people in the United States, their water supply through their tap water has been fluoridated, or fluoride has been added. And many, many countries around the world do not. Apparently China has naturally occurring fluoride in their water, and because of the negative impacts that fluoride has on the health of the Chinese, they spend a lot of time and money and effort actually trying to pull fluoride out of the water, when we here are adding fluoride to the water. It kind of doesn't make sense. So bear with me. I'm going to read these bullet points. I'm not going to get into the details of every single bullet point. I'm going to invite you to go to fluoridealert.org to read about it yourself. And then I will just give you some options at the end of this discussion for what you can do to get your water clean enough to actually be able to consume it, and then also to replace some of the things that we use for dental care. Okay? So according to Dr. Paul Connett, fluoridation is a bad medical practice. Number one, fluoride is the only chemical added to water for the purpose of medical treatment. So according to the FDA classifies fluoride as a drug. And so the fact that it's a drug, this leads to the problem number two, and that is that just throwing a quote-unquote drug or a medicine or some type of pharmacological agent, according to the FDA, into the general water supply is unethical, because you as a person consuming the drug are maybe consuming it against your own free will without the actual consent, informed consent, so that you know what the negative impacts are and you can make a choice as to whether or not you want it there or not. It's basically a mass drugging of society through the water. So part of the problem with fluoride, especially if it is considered a drug, is that the dose cannot be controlled. You cannot control from person to person how much tap water they're consuming. And many times, especially in low-income areas where tap water is being used primarily as the source of water, especially for things like infant formula. You've got high concentrations of fluoride going into a very small infant body, and so the toxicity levels in the babies is extraordinary, especially in areas where people only have access to fluoridated tap water. The fluoride goes to everyone regardless of age, health, or vulnerability. So some people have kidney issues, diabetes, heart disease, thyroid dysfunction, or they're tiny little babies or frail elderly, and we're all being exposed to the same amount of fluoride, which is ridiculous, because if it truly is a medicine or a drug, as the FDA classifies, then you would be trying to dose it accordingly. As in, an infant would not get the same dose, drug, or medication as an adult would. That doesn't happen when it's just thrown haphazardly into the water system. So I hope you enjoyed this part of our fluoride hazards, dangers, and toxins series. Please join us for the next part.